Welcome. Today we're diving deep into a condition that affects the urinary system, specifically the bladder trabeculation. We'll explore what it is, why it happens, how it's diagnosed, and what can be done about it. So, let's get started on understanding this important condition. Bladder trabeculation is primarily caused by long-standing obstruction of the bladder outlet. This obstruction prevents the bladder from emptying properly, leading to increased pressure inside the bladder during urination. The most common culprit is benign prostatic hyperplasia, or BPH, in men, where an enlarged prostate gland compresses the urethra. Other potential causes include urethral strictures, bladder neck contracture, neurogenic bladder dysfunction, and even certain medications that affect bladder function. Now let's talk about the pathophysiology. The chronic obstruction forces the bladder to work much harder than it should to push urine out. This increased effort causes the smooth muscle layers of the bladder wall, called the detrusor muscle, to hypertrophy, or thicken. As the muscle thickens unevenly, it creates ridges and columns of muscle, which we see as trabeculations when looking inside the bladder. These trabeculations reduce the bladder's elasticity and capacity and can eventually lead to bladder decompensation, making it even harder to empty. While precise epidemiological data specifically for bladder trabeculation is limited, we can infer its prevalence based on the prevalence of its underlying causes. Since BPH is a major contributor, bladder trabeculation is more commonly seen in older men. The prevalence of BPH increases significantly with age, affecting a large proportion of men over 50. Consequently, the incidence of bladder trabeculation also rises with age, but specific numbers are often bundled with general lower urinary tract symptoms. The signs and symptoms of bladder trabeculation are often the same as those of the underlying conditions causing it, primarily bladder outlet obstruction. These symptoms can include a weak urine stream, difficulty starting urination, frequent urination, especially at night, and nocturia, a sense of incomplete bladder emptying, urgency, and in some cases, even urinary retention, where the bladder cannot empty at all. It's important to note that some individuals may not experience any noticeable symptoms in the early stages. Diagnosing bladder trabeculation usually involves a combination of techniques. A thorough medical history and physical examination are crucial. Urine analysis is performed to rule out infection or other urinary abnormalities. Post-void residual volume is measured to assess how well the bladder empties. Uroflowmetry, which measures the rate and volume of urination, can help identify bladder outlet obstruction. Cystoscopy, where a thin, flexible tube with a camera is inserted into the bladder, provides a direct visual examination to confirm the presence of trabeculations. Ultrasound or other imaging modalities may also be used to evaluate the bladder and prostate. While bladder trabeculation itself doesn't have official classifications or types like some other diseases, the severity can be graded based on the extent and prominence of the trabeculations seen during cystoscopy. This grading system helps guide treatment decisions. Mild trabeculation might require watchful waiting, while severe trabeculation may necessitate more aggressive interventions. The treatment and management of bladder trabeculation focus on addressing the underlying cause. For BPH, medications like alpha blockers and 5-alpha reductase inhibitors can help relax the prostate and improve urine flow. Minimally invasive procedures like transurethral resection of the prostate TURP or laser prostatectomy may be necessary for more severe cases. Urethral strictures can be treated with dilation or surgery. Neurogenic bladder dysfunction requires specialized management, often involving intermittent catheterization or medications to regulate bladder function. The goal is always to relieve the obstruction and allow the bladder to empty completely. Preventing bladder trabeculation primarily involves managing the risk factors for its underlying causes. For men, this includes maintaining a healthy lifestyle, which can help reduce the risk of BPH. Regular check-ups with a doctor are essential, especially for older men, to monitor prostate health. Prompt diagnosis and treatment of any urinary symptoms can help prevent the progression of bladder outlet obstruction and the development of trabeculation. The prognosis for bladder trabeculation depends largely on the severity of the condition and how effectively the underlying cause is treated. Early diagnosis and intervention can often prevent further damage to the bladder and improve urinary symptoms. However, if left untreated, bladder trabeculation can lead to complications such as urinary retention, bladder stones, urinary tract infections, and even kidney damage. Recent research is focusing on developing less invasive surgical techniques for treating BPH and exploring new medications that can improve bladder function. The field is constantly evolving, offering hope for better management and outcomes for individuals with bladder trabeculation.